that, but they just kind of go with it. So there's a couple of female fighters, like Michelle Watterson always wears headgear because she doesn't want to have big old swollen ears. I mean, I wouldn't want to do it, but that's just me.
Yeah.
You know, when I wrestled in high school, we always wore headgear. But a lot of these guys, you know, it's a badge of honor. And, you know, you ever see somebody out at a bar with cauliflower ear, that's probably not the one you want to bump into, right?
That's a telltale sign.
That's the guy you want to buy a drink for,
Yeah,
right?
exactly. Now, are some people just more susceptible to cauliflower ear? Or
Yeah, some people's ears are more susceptible to it, but essentially what it is you get these broken blood vessels in there and they swell up. So if you don't drain it right away, basically your body puts scar tissue down over there and it thickens. And so it just thickens and thickens. And some people, it closes all the way down to where they can't even hardly hear.
Oh, wow.
So then what they have to do is they'd have to cut you open and scrape all that stuff out, which not a lot of fun.
That doesn't sound good at all.
Yeah.
Look, want to talk to you a lot more about the stuff you do over at Jackson Wink. You got another segment in you?
Yeah,
We'll take a
absolutely.
quick break. Okay, we'll take a quick break here. We'll come back more with Dr. Bo Hightower next here on the Sports Bar, 610, the Sports Animal.
Albuquerque's Lobo Station. Sports Radio 610, the Sports Animal.
Michael Carlisle, Mike Trujillo, the Sports Bar, 610, the Sports Animal, joined in studio by Dr. Bo Hightower. We were talking off air about some MMA stuff. Tell us exactly what you do with Jackson Wink.
So I'm the head of sports medicine for the gym there. So basically any kind of injuries, they go through me. And then we decide if we're going to be able to fix them there in the office or we need to go get x-rays or MRI or go see a surgeon. So we've got a nice little network of surgeons, family doctors, chiropractors, physical therapists, where we can send people to get the right care they need and get them back in the cage.
Now, outside of whatever injuries pop up, is there one thing that's more of a concern when it comes to the fighters than anything else? Like specifically, is it the weight cutting? Is it stuff like that?
Yeah, we don't really know the long-term ramifications of weight cutting, but we know it's not good. I mean, you can damage your thyroid permanently with it. I mean, we saw Matt Metrione. He had 24 kidney stones they had to pull out of him.
Yeah.
He had to pull out of that fight with Fedor recently. So there's some major issues that can go on with your kidneys. And as we see, as they start to age, they have a harder time making that weight. And we don't exactly know why that is. We think that maybe the body's not producing antidiuretic hormone anymore. So in order to flush all that water out, your body's desperately trying to hold on to it. And it's going to fight that.
Yeah.
And once you do it a few times, your body knows it's coming, and it's going to fight life and death to stop that.
Yeah, and it seems like a lot more attention's been brought to that recently. Of course, UFC's gone to the earlier weigh-ins, and that's been met with mixed results. And you mentioned, as you get older, and that's certainly true, but we're seeing it a lot with the younger guys as well. Ray Borg and his last fight? He missed weight or the fight before?
It was a fight before.
Yeah, the fight before he missed weight. Nurmagomedov, before the last pay-per-view, got sick during his weight cut.
Right.
Do we need to reevaluate the weight classes, the way we go about it? Should fighters fight closer to their natural weight?
Yeah, that's a tough question, man. When you look at it, it seems like the early weigh-in has actually been a bad thing because whether it's habit or whatever else, everybody's used to making weight at the end of the day. They thought it would be a good thing, but there's been way more people missing weight with the early weigh-in than before because you only have that hour window.
Right.
And a lot of people, they're sleeping, and so they get up and, if they're still tired or wiped out, they're going to have a hard time getting that last bit of weight off. Whereas if they had the whole day, they can, have somebody carry to them to sauna. But that in itself is part of the problem, right? We're having to carry people around.
Right.
I mean, I had to help carry Kelvin Gastelum to his, to a car to turn on the heater in Dallas one time because he couldn't move anymore, and he had to lose, another pound. They gave him an hour to do it. I've been there when Johnny Hendricks was struggling too, and these guys do not look good when this is going on. It's a tough situation. So I have two thoughts on it. One, yes, there's a couple areas where we probably could use more weight classes. So you go 170 to 185, 185 to 205. Those are major jumps. So we probably need some intermediary classes there. But when you talk about weight classes, California just instituted this thing where if you're 10 pounds over the day of the fight, you get fined and basically you're not allowed to fight at that weight class anymore. That's actually pretty ingenious because everybody, no matter what you do with it, they're going to be pushing the limits and they're going to try to get to be the heaviest guy in the cage possible.
Sure. And that's another one of the things that's so bad about weight cutting. Yeah, you go through all that grind, that gruel to weight cut, and then you immediately start trying to put weight back on, whether it's rehydrating, whether it's eating. And, you hear tales of fighters, putting, 20-plus pounds back on from weigh-in till the next day for fight day. that's just not good for the body from going from extreme to extreme.
No. And I would argue this too. So I love when the guys that I'm with are fighting closer to their weight, because here's the thing: when you're killing yourself to make weight like that, you're not even thinking about the fight. You're not, going through the fight in your head. You're not thinking about game plan or strategy or anything like that. You're fighting a fight before you even get to the fight, and a harder opponent too. So by the time you do that, I mean, you just want it to be over, I think, a lot of these guys and gals. And so basically they're not mentally prepared to fight because they killed themselves to make this weight cut. So what was the purpose of this? All your game planning, all the mental preparation, getting your body right is all out the window at this point because you tried to kill yourself to get that extra 10 pounds off.
Talk to us about some of the specific fighters over at Jackson Wink that you've worked with and some of the things that you've seen them do that maybe drives you a little bit crazy.
All right, the easy one is working out too many times during the day. And some of these folks, you're not going to get the work ethic out of them. So one of the guys that I think is leading the way is Alistair Overeem, because he will actually, he's been fighting for 18, 19 years, so he listens to his body. If he wakes up and he doesn't feel good, he's like, I think I'm going to take today off and do an active rest day. He understands that if you try to push it when you're not feeling good, that's when injuries happen. That's when bad things happen. A couple of these other guys and gals, they're old school and they're going to work out, 4 or 5 times a day, and they wear it like a badge of pride. And there was a time, again, and I'm not saying anything about these fighters here, there was a time in these sports where, the TRT era in particular, your body probably could recover from 3-4 sessions a day because you had support. Your Dan Hendersons, your Vitor Belforts, people that transformed dramatically. But those days are gone. You have to just train smarter. And as they get older, too, they have to realize the accumulation of injuries will set you out, and you won't be able to train well. So you're better off at this point. You know how to fight, right? So you know how to fight. There's not some brand new thing you're learning. What you should be doing is working your game plan, getting your cardio up, drilling a little bit, and staying as healthy as you possibly can for these fights.
You mentioned Alistair Overeem, who beat Mark Hunt at UFC 209, but he did it having food poisoning. Yeah. How remarkable was that?
Yeah,
that was a rough one. I was in his room that night, so it was a pretty rough go at it. He texted me. He's like, meet me after the official weigh-ins. So he comes over and he's holding his stomach, and he's like, man, I'm not good. His eyes were sunken in and not feeling good at all. He didn't actually remember me treating him that time. That's how bad he was. So after he got IV'd, he's like, hey, can you come treat me? And I was like, again? He's like, what do you mean?
Wow.
Because he was so out of it. He couldn't hold any food down. No, he was coming out both ends.
Yeah.
So they got the approval, the TUE, and then he got hydrated up. And then, he was basically saying, listen, we already lost Khabib off the card.
Yeah.
We can't afford to lose, another big name off this card.
Yeah, and Dana came in, Dana White, in the post-fight press conference with Overeem there, and just sat down and publicly thanked Alistair for toughing it out, for going in there, and not only taking one for the team, but coming away with a victory as well, and looked really good doing it.
Yeah, and when does he ever do that, right?
Yeah.
So, especially with them having a strained past, I thought that was pretty cool. And I'm glad to see the relationship is mended. And, over him, he does the right things, man. The guy's been at it a long time. He's got a level head on his shoulders. He knows who to have around him at this point. And he's a heavyweight title contender again. He's that close.
Yep. Now, he was a guy you mentioned that listens to their body, and if he's not feeling it, he just won't work out that day. And we're talking with Dr. Bo Hightower here on the Sports Bar. Then you've got guys like Cowboy Cerrone, who, if you'd let them, would fight every weekend.
Right.
Do you ever say to guys, look, let your body heal up a little bit? There's no shame in taking a couple of days off.
Yeah, Cowboy's going to cowboy. There ain't nobody who's going to tell him, not to do something. So, some of these guys, you just roll with it and say, hey, how can we help you the best we can? The people that overtrain, most of them are from Albuquerque, so they have that warrior mentality, and you're trying to peel them back a little bit. Do you really need to go run 4 miles after you've already worked out 4 times today? Maybe you should just go eat and hit the cryo or watch a movie, spend time with your family. Let's peel it back a little bit, guys.
Exactly. In all seriousness, how important is it to you? Not just because you want to see them do well, but because you are a doctor, you want to see them stay healthy, to take care of these fighters, make sure they don't overdo it, make sure if they are injured, whether it's seeing you or a different physician or rest or whatever, how important is it to you to make sure they get the treatment that they need?
It's vitally important. So we're having to balance two different things, right? Long-term outcomes and then the short-term ability of them to make a living to feed their families. So we're in the fighter's corner no matter what. So we want to make sure that they're presented with all possible options. That way they understand fully informed consent of what could happen if they continue forward and what could happen if they have an operation and what could happen if they just go ahead and just do what they're doing. So basically, if we don't think it's going to hinder their performance or cost them money, and this is a team decision, obviously, I'm just advising, Coach Wink and Coach Gregor and the fighters are making those decisions. But, thankfully they listen to me, pretty well. And I try to put it in a realistic sense because, I am around these fighters so much. I do understand what it means to them. Luckily we've had 3 people in the last 3.5 years, over 180 fights that have had to pull out of fights. And, broken hand and broken ribs. So what are you going to do?
Exactly. Now, in addition to the fighters, you've flown out to sets for TV shows. You did your sports medicine residency. You were working with the Colombian Olympic team, I believe.
Yep.
You're everywhere, man.
Yeah, the job's pretty cool, actually. I can't complain, I suppose. Yeah, it's been pretty cool, man. One of the coolest stories was we got a call from Marilyn Manson's manager last year, and they're like, "Hey," and we didn't know who it was. Of course, we're like, "I wonder if it's a bandmate or whatever." And they come down, and he's in the hotel, and he's like, "Can you come see Manson?" I'm like, "Well, it's going to cost you."
That's weird, but that's cool.
Yeah, it's going to cost you. So we come in, he's sitting there, it's like, "Manson."
Wow.
And we're like, "Oh," and he's like a pretty normal dude,
Or that
Right.
he's really pale, right?
Yeah, super pale. But you could tell he's brilliant, but you can tell it's also an act too. So then, we go to the concert and everything like that, and we get all the backstage, perks of that. So I'm treating him in his bus right before he goes on stage. So he had jumped off into a mosh pit, sprained his ankle massively at the show before, and he was going to cancel the show here.
Mm-hmm.
And so we were able to get him going on that ankle and able to at least walk around and get on his stilts and everything like that. So he comes back, and then we ended up in the travel bus for 2 or 3 hours after the show. So
Gotcha.
that was an interesting time.
I bet. And real quick, I got to ask you, what's happened to my invitation to Mensa 1% Society and all that? Because I haven't gotten mine.
He's a legend in his own mind. Don't listen to him about that.
Do you know what it means in Spanish?
No.
It doesn't mean what you think it means.
No.
Let him be as Mensa as he liked to be.
Well, look, I just like it when I can be around other people with high IQs. And in all seriousness, you are a member of several high IQ societies, which makes me admire you more and hate you at the same
I
time.
love hate relationships. we're just getting started here, I guess. Huh? All right, I'm ready.
Yeah, and you did work. You talked about the Manson thing, but real quick as well on the set of Independence Day 2, the TV show Night Shift. So they call you up and they got the money. You'll go help them out. You go fix them up.
Yeah, the concierge service is a little pricey. So if somebody's going to take me, my commitment is to New Mexico.
Sure.
New Mexico first. The people of New Mexico, I'm here to help people. So if you're going to pull me away from my practice, it's going to cost you a pretty penny. I mean, you're going to be talking, get out the checkbook.
Yeah.
Because I want to make sure that we're here to take care of the people of New Mexico first and foremost. That's our goal. We want to make sure that everybody can do the things that they want to do, whether that's picking up their grandkids or going for a walk or getting in a UFC fight or, whatever they want to do. We're here for New Mexico. And if you want to fly me somewhere, get out the checkbook.
So keep that in mind, Axl Rose, just in case you jump off a stage.
There you go. Wish we had more time with you. I know you're a busy guy. You got things to do. You got to save the world one patient at a time. We do appreciate the time so much. And
Appreciate you guys having me.
Yeah, man, let's do this again soon.
Absolutely. Sold.
All right. Dr. Bo Hightower joining us here on the Sports Bar. It's Michael Carlisle, Mike Trujillo, 610, The Sports Animal.